Hey guys, welcome back to Medicine Deconstructed. I'm your host, Dr. Jay Rutland. I've spent a lot of time talking about the immune system, but I haven't spent too much time on what happens when it goes completely wrong. Let's chat about that right now. You guys all know that I've described the different layers of the immune system. Remember, the first way to describe it is by starting with the innate and the adaptive immune system. The innate immune system consists of neutrophils, macrophages, basophils, eosinophils, mast cells, among others. They're the cells that respond to any insult. Doesn't matter what it is. Then there's the adaptive immune system. That is the cells that will specifically respond to a pathogen's characteristics. These cells are B cells, T cells, dendritic cells. There are really two lineages of white blood cells. All the cells stem from this. There's a myeloid lineage, which leads to platelets, erythrocytes, or red blood cells, eosinophils, basophils, neutrophils, and monocytes or macrophages, as well as some dendritic cells. And then there's a lymphoid lineage, which leads to dendritic cells, as well as natural killer cells, T cells, B cells, and plasma cells. Immunodeficiency is defined as defects in various components of the immune system. Any of those cell lines can go wrong. There are primary immune deficiencies and secondary immune deficiencies. Primary immune deficiencies are caused by intrinsic or congenital defects, while secondary immune deficiencies are caused by the environment, treatments, cancer, or malnutrition. The first disorder I want to address is a condition called severe combined immunodeficiency, or what we say, SCID. SCID is actually a group of diseases caused by different defects in individual genes that have similar functional consequences. You can have problems rearranging DNA to form variable regions of antibodies or T cell receptors. You can have a genetic defect in cytokine receptors. You can also have an issue with the intracellular signaling cascade. Then cells can't communicate. If cells can't communicate, they can't call who they need to help. Bad things can take over. T cell defects happen as well. DiGeorge syndrome can be as a result of a deletion of a chromosome 22. There's an abnormal development of the thymus. You will have abnormal levels of immunoglobulins. You can also have Behr lymphocyte syndrome. This means you have defective intracellular signaling. This can lead to a reduction of T cell numbers and a reduction in immunoglobulins or antibodies. I spent a lot of time talking about the B cell. These are the cells that make antibodies. There can be defects in those as well. Remember, B cells are responsible for antigen presenting. That is, they look at an antigen and will present it to certain cells, and they also make those antibodies. There's a deficiency called X-linked A-gamma globulinemia, which results from defects in the Bruton tyrosine kinase. This leads to a drastic decrease in B cell numbers, so you're going to get a drastic decrease in antibody levels. This is similar to common variable immune deficiency, or CVID, which also leads to a number of reduced immunoglobulins. The single most common immunodeficiency is a selective IgA deficiency. Remember, IgA is the antibody which covers the mucosal layers, the lung, the upper respiratory tract, the stomach, other mucosal areas. There's also a hyperantibody syndrome where too much IgM can be produced, and when you cannot bind to CD40 on some of the cells or CD154 on B cells, you can't isotype switch, so all you can produce is IgM. We spent some time talking primary immune deficiencies in the adaptive immune system. If we head back to the innate immune system, we can talk chronic granulomatous disease. This is as a result of defective enzymes and other microcytal molecules. So the phagocytes, like neutrophils, lose the ability to degrade ingested microbes. They can't kill them. Obviously, this leads to problems since the microbes survive. There are also defects in the complement system. Remember the complement system, that nerf ball system I've talked about before? Since these little nerf balls are out marking organisms, if you have deficiencies in complement, you can't mark things. Unfortunately, one of these complement deficiencies can lead to what's called hereditary angioedema. You get facial swelling, in addition to other symptoms, which are also going to lead to recurrent infections. There are secondary or acquired immunodeficiencies. Obviously, human immunodeficiency virus, HIV, is one of these. This virus infects CD4 cells. These are helper T cells. But secondary immune deficiencies are usually due to us, meaning we give people these therapies, which are going to kill cells that grow fast. Chemotherapy, which kills cancer cells, which grow fast, can kill neutrophils because their half-life is 6 to 12 hours. Lymphoma and leukemias lead to secondary immune deficiencies as well. Lymphomas are tumors within the lymphoid tissues, and leukemias are composed of dispersed single cells that arise from the bone marrow and may involve other cells from that myeloid lineage. From my perspective, as a physician who pays attention to the immune system, I always check cell counts and immunoglobulin levels in patients with presumed defects secondary to their own protoplasm. Thanks for joining today's episode of Medicine Deconstructed. I really appreciate you guys being here. This is where we arm you with information. Please come back next time for some more ammunition. Take care.